You cannot automate me at 2 o'clock in the morning in a ditch, intubating a patient while it's raining and thundering and lightning.
That's a great point. This could help with workforce shortage issues.
Yeah.
If we would take care of our employees, they will take care of our patients, they will take care of you. And the issue is maybe we've got this backwards. And I like it that, and I didn't take offense to you at all. I'm not saying reimbursement is important. Of course, you need that. You need that piece of it, but maybe we have focused so much on that. We've lost sight of what the real priority is, and all that will come into clarity the moment that we continue to circle this around as well.
One day I came home and she had a 2-week-old in her lap and a 22-month-old, and I said, I'm done with EMS. I was like, I'm out.
Welcome to another episode of the Leadership Lab with Asbel Montes. Today I'm really excited about this conversation that we're going to have. And I know that possibly I am going to get some emails and text and maybe some comments regarding the discussion that we're having today, but I think it's pivotal that we have this discussion in healthcare. And so to that point, a friend of mine, Larry Richardson, I'm going to let him introduce himself here or whatever, but Larry and I have known each other for several years, and I'm really glad that he took the time to come here in studio here in Austin, Texas, from Nashville, Tennessee, or Franklin, we should say. So introduce yourself to our audience, Larry.
Hi, so I'm Larry Richardson. I'm the chairman and CEO for AmeriPro Health. I'm also the founder. So, started in the Marine Corps straight out of high school. Went into the Marine Corps, got out, went into the fire service.
Thank you for your service, military. Yeah, thank you for your service, Larry.
Went from private service to public service, kind of like, spent majority of my life just back and forth. Met my wife in the fire service. She was a paramedic. She spent 24 years in the fire service, just retired a couple of years ago. And, one day I came home and she had a 2-week-old in her lap and a 22-month-old. And I said, I'm done with EMS. I was like, I'm out. She's like, what do you mean you're out? And I was like, I'm done. I'm tired of how antiquated it is. I'm tired of all of these things. I'm ready to do something else. And she said, okay. She goes, well, you still have to work. I was like, I know. So I started going to a university in Atlanta, Clayton State University, and, was just taking 15, 18 hours a semester. When my shift would fall on a day that I had to go to college, I paid somebody to work for me or got a shift swap or something. So it was a lot of years that was no sleep because I had 2 children that didn't sleep. And so I think my 56 hours staying awake is about my longest time. But I decided, I was like, I'm going to go be in an intelligence agency. So I did. I went, applied for an intelligence agency, got a job offer, and my wife had got promoted to battalion chief, and she was like, that's not going to happen. And interestingly enough, they wanted me to move to Virginia for about $57,000 a year. And I was like, well, that's not going to work. So I was like, I'm going to go to the University of Georgia, go Dogs, and I'm going to get an MBA. And I had spent majority of my career in the Marine Corps, Fire Service. So I didn't understand balance sheets. I didn't understand P&Ls. I didn't understand any of that. So it was like learning a whole new language. And when I got there, that's when I, through a cohort of mine in the program, I met her husband. He was my business partner. And, he and I started talking, and it was just like, you don't hate EMS, you just hate how it's been ran. And I was like, well, that's a good point. And so, I came full circle, and I was like, well, let's build something different. So on my 41st birthday, I sent my wife a text and said, all right, I'm quitting. So I quit where I was working, walked away from 2 retirements, and leveraged everything I had, kidneys, sold my wife's kidneys and everything. And, we started AmeriPro. And, it was a total different way of the way we started it. We had data people before we even had paramedics. So one of our first employees was Todd Turpin. He's one of our vice presidents now. Todd was, we started AmeriPro literally in my bonus room at my house. And then we built it. And, we have consistently built it. We're now in 10 states. Roughly 1,500 employees, over 340-something ambulances. We do 911 services, interfacility services. And in April of 2024, we took on private equity investment, and, our partner is Whistler Capital. And, those guys have been absolutely amazing. I can't say enough about what they've done for our business. And, we'll get into what that is, but I can't say enough about what they've done to the point that, we are so connected at the hip that I uprooted my family in December and we moved to Nashville. And that was, I'm 20 minutes from the managing partner's home. I have an office inside their office, and we work diligently together every day. And it's been a real eye-opening experience for me. This is my first time CEO. I've never been in the corporate world, but I have. I guess some would say taken like a duck to water. And with our equity firm, we have just been, charging ahead, and the things that we have been able to do in just 2 short years has just been astronomical.
Well, number one, thanks, Larry, for coming in, because I think this is a pivotal point of the conversation that we're going to have today. And you said a little bit about this in your background. So
Hmm.
we didn't prepare this. We had an outline of kind of some of the questions that I wanted
Yeah,
to prepare you
yeah.
for. But many times right now we're seeing within healthcare, because healthcare is changing and it's changing very rapidly. There's
Hmm.
a lot happening in healthcare. And I know sometimes private equity and venture capital in healthcare is looked at through two different lenses. Some people
Hmm.
hate it, they want it out of healthcare, and some people like it being in healthcare. And I think there's probably a middle in between where it is needed in healthcare. It's the
Hmm.
reason why we're so innovative as a healthcare conglomerate here in the United States of America. Now, there's individuals on the other end that would indicate, yes, we're innovative. There's a lot of money here, but are the outcomes better than other first world countries? I've heard arguments from friends of mine in different think tanks, things like that. But I really want to get to the crux of it. So, number one is I want to say thank you for actually agreeing to come on the podcast. I've
Yeah,
had a lot of people from private equity, and you're like, oh, come on. Let's come on. You were even going to get some of your private equity partners to come on
yeah.
as well. And we kind of talked through that piece of it. But just for our friends that are listening here as well, you can hear the Southern accents.
Yes,
I'm a
absolutely.
Carolina boy and he's a Georgia boy. And
That's
that's what
right.
you're. So we're going to say a lot of these country euphemisms. You just said one right now. And I think I'm going to write that one down. I
Yep,
haven't heard that one before.
yep.
But I like those things or whatever. So it comes out or what have you. But don't be deceived by the accent.
Sure.
I love it when sometimes some of my friends and I'm going to pick on my Northeast friends sometimes, are thinking, oh, those Southern hicks. Just because we sound Southern doesn't mean that we're not intelligent.
That's right.
And that to me is what you begin to do here at AmeriPro Health. So let's talk a little bit about private equity.
Hmm.
I'd really like to understand the journey that you came on. You said 2024. Is that right? Did I
Yep.
get that?
Yeah. April
2024,
1,
you came
2024.
on
Yep.
private equity. Tell me why AmeriPro began to look at this. What was the benefits of saying, you know what, we need an infusion of capital. We need to look at this from a growth. Give us a little bit of a background of why you even as a healthcare entity
Well, let me
moved into that
back up
space.
just a little
Okay?
bit to explain that. So, uh, one of the biggest things is obviously capital helps on multiple levels. Some of the things are, for example, when I left after 18 years of riding in the backwards of an ambulance, critical care paramedic, and I started AmeriPro, I was making $43,000 a year. That's it.
Mm,
And if you look at just
it's
today
hardly a livable wage.
across
Yeah.
the nation, that's not even heard of, which is a good thing. That's great. Finally, the paramedics and EMTs are getting the pay that they are duly desired. The problem is reimbursement is not kept up. The cost of business has, equipment, fuel, everything you can name under the sun has grown by 40% in cost. So, one of the things that I also did while before we went through the transition was, I wanted to know more about the finance world. And I went to the University of Miami and got a master's in finance during COVID. And the one thing that it taught me was I do not want to be a CFO. I do not want to be in finance. But it gave me a very appreciation of what was out there and what needed to happen to be able to grow AmeriPro. And, when you look at, for example, you go into a market and you want to provide a service for a county, and let's say the county needs 20 ambulances. Okay, 20 ambulances cost a lot of money, and you have to hire everybody. You have to do all of that. You have to set up all of your reimbursement. You have to set up all your licenses and all that stuff. And maybe the county's like, "Hey, I need you in 30 days." Okay. And we've kind of been known for that across our footprint, not because we wanted to, but just because of how the industry has been. We have been done startups very fast. One of our startups was in 12 hours. I mean, because
Wow.
the previous provider had had such financial crisis that they needed somebody immediately, and we stepped in and did it. None of that happens without capital. None of that happens without capital. And when you look at what we were doing then as we were growing, I want to say that we were in 8, 9 states at the time. And, just the demand for our services just kept growing and growing and growing. And I don't want to stop that because my goal for this is to get access to healthcare to as many people as we can.
So what's the misconception that the public has around private equity and not just you're in the EMS space and the
Mhm.
healthcare, but just in the general in the healthcare space? Why is there this misconception with private equity?
I think to peanut butter smear, another Southern saying, to peanut butter smear uh, every private equity as under the same label is kind of intellectually lazy. You have to do your due diligence.
Thank you for saying that.
Um, I think it is very much needed. It has provided us with an enormous amount of resources. But on the flip side of that, there are probably private equity firms out there that don't have the same, you know, MO that others do. So it all comes down to who you partner with. Who do you partner with? Do you partner with somebody that's going to be a financial landlord, or do you partner with somebody who's going to be a co-builder and sharing in the passion that you have to grow your business, to provide access to healthcare, to provide a place for paramedics and EMTs to be paramedics and EMTs, and be able to grow that brand? And that is what attracted me to Whistler. Whistler was very uh, it was all about what can we do? What do you need help with? And still to this day, it is what can we do? What do you need help with? What do we need? And it's making connections. It's, hey, look, we got this. They have a company that they have co-invested in on the AI side. All of those things they bring to the table with us, and there's no inhibitions to it. It's a true partnership, and they share in my passion. Hey, look, this is great, and it's all in who you partner with. And the public's misconception is, it's the barbarians at the gate. It's not, at least in my experience. And, when you look at private equity and the resources, because, usually private equity has a bunch of investors that come into there, you're just amplifying your network. You're amplifying who you can connect with, hey, look, this guy has this. Hey, great, go meet with them and understand how they do their business. Hey, look, there's things that we can learn. There's just so much that we have gotten from this. It's been a positive, and, we've continued to grow. And since I want to say, I don't know the exact numbers, but from April till now, we've probably doubled or tripled the size of the company. I think we're at triple the size of the company. So just continuing to do all of those things, and none of it would have been possible without Whistler Capital.
So let me ask you this because you gave a really great analogy, and I'm going to try to paraphrase what you just said here. We were looking for a growth partner versus a landlord,
Yeah.
which I thought was very interesting, very similar to we've seen it in the healthcare sectors. I mean, they're experiencing it right now in home health,
Mhm.
where you have all of these individuals that they have been in LA. They just busted over 900 home health agencies, and 700 of them appeared to be fraudulent. So, but that doesn't make all home health agencies bad, and that's
Right.
what I'm hearing from you with private equity. It's not all private equity is bad. There are some
No.
have different. And so you guys decided to partner with a growth partner that said, you know what, we can take this and we can elevate what your vision is for healthcare in these communities. Because this is the point I want to ask. You mentioned in your opening when you were giving your background about
Yep.
how you had started making 45,000 Now they're not really doing that, and some of this stuff would not be possible had you guys not partnered with private equity, moving in very quickly into areas that needed a 12-hour
Yeah,
whatever to have that capital piece of it. Did you notice of course, I'm a finance guy, so I'm always on the reimbursement side of things.
sure.
So did you notice, like, in the receivables not keeping up, did private equity bring partnership and expertise in those arenas that maybe you didn't have before? Can you talk a little bit about that from a
In
healthcare perspective?
every aspect of the business, they brought expertise. Every single aspect. They brought expertise in HR, brought expertise in finance, RCM, everything. I mean, it literally, the old saying is, 4 eyes are better than 2, and that is exactly what it's done. And, "Hey, Larry, you think about this." "Yep, that's great." Sometimes they bring an idea, I'm like, "Well, we've done that before." "Okay, great." It's not like, "Well, you have to do this because" no, it's not like that. It's very much a collaboration. They're a co-builder of this business.
That's an interesting statement, not to interrupt you there. They're a co-builder.
Yeah.
Tell me why you say that, because I've talked to some individuals that don't feel that same sentiment.
Mhm.
And so I'm kind of trying to weed for those that are listening that are talking about this, because many times I hear it's either people are pro private equity or they are literally against private equity. I barely see people in the middle, like thinking, one way or the other. You either love them or you hate it. So tell me about that co-builder, because that's an intro. I've never heard that statement before, that they're actually co-building AmeriPro with us through
Yes.
the construct. Explain
Yes.
that to me.
I mean, so for example, we're looking at different things with our technology and all of those things. Some things that would take us months of consultants and things and all of that stuff, and it's like, "Hey, we already got this. Hey, we got right. Let's work on this right here." The managing partner, Jeff Clark, um, the smartest person in the world, I think. I make a joke about it all the time, and if he watches this, he's gonna roll his eyes. But I think him and Elon get on a rocket ship and they go home on the weekend and then come back and figure out, how to, and figure things out for humanity. Just a super intelligent guy, and the things that we can, the two of us together think about, and things that we do, and things about like, hey, look, let's do this, or it's literally a partnership. And it goes back to who you choose, you know? Um, my wife and I have been married as of the other day, 20 years. We just hit our 20th anniversary, Not every marriage is like that, Mine is. And it all chooses on how your partner
So let
is.
me ask you that question, the choice.
Mhm,
How did you go about making the choice when you went from a for-profit company that was privately owned?
mhm,
You're still privately owned,
yep.
but went to a private equity. Tell me how that choice, how did you choose the right co-builder? I love that word, that co-builder.
We had management presentations. We went through management presentations, and we kind of you talk with a bunch of guys. It's kind of a round robin. You have dinner. All of these things, and you kind of get to know them, and you get to talk, and you get to understand what their ethos is, and you
So
get
this
to
isn't something that just happens in 2
no,
weeks.
no, 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 no. This is a 6 to 9 month
So it's like a
process.
courtship,
It
like
is.
like to use your analogy about you're on it, you're dating
It
these.
is. It is.
Okay.
It is very much like that. And just when we met with these guys, they were the first guys that we met with, and I was like, "That it's them." And the rest of them, I was like, they're second. I just couldn't, I couldn't get that personal like vibe, I guess you could say, from them. So it was, and we still carry that to this day. I mean, I between the managing partner, another one of the partners, we speak, I don't know, 7 8 days a week, and I say 8 days a week because there's a lot of times that there's multiple times, yeah, it feels like 8 days a week, but I mean they're, it's just for us, it has been something that has really been able to help us build the business.
Well, and I think that people that are hearing this right now, because I think this is the reality of what I want to be understood in the PE world, no matter where you sit, is it's not like something. I think some people have this connotation that you're just sitting in there, everybody's just looking at the numbers. How can we make more numbers on the back of healthcare, on the back of patients, on the back of healthcare delivery, not understanding that what we're seeing is there is like this element that people don't see.
Mhm.
It's like this courtship, and I'm going to use your words because that's exactly what it is. It's like we're trying to make sure this fits along the same lines of what our delivery, what we're trying to do in our communities that we serve. It's not like people in Wall Street. You're up in Wall Street sitting with a bunch
No.
of whiteboards and figuring out and forget about where the patient is, whatever. That's the experience that I'm trying to make because that's
Yeah.
generally what most people feel. Are there some of these things going on in healthcare? Absolutely. I'm
Yeah.
sure there is, just like there's fraud happening in LA with the hospice, just like we experienced in an ambulance around dialysis transports in hot spots where they were committing fraud and not transporting patients.
Still
That
are.
happens. Yeah,
They still
that
are.
happens in every industry. And
Yeah.
so that's the point that I think you're making right now is to saying we would not be able to do some of the things that we're providing in these communities. So explain to me what you were doing pre Whistler, is it
Mhm.
Whistler
Yeah.
Partner?
Whistler Capital
Pre-Whistler
Partners.
Capital and post, what is the difference between the 2 that you've been able to deliver in some of your communities?
The biggest thing is, you know, I spent 18 years in the back of an ambulance. And I have said this since day one is if we are going to continue, if you, for example, if you take EMS, the compounded annual growth rate, depending on the source, for EMS demand is about 9.6% a year. That is huge. The other uh, markets or professions that are growing that fast are technology, energy, and AI. Everybody talks about those because they're sexy. They don't talk about EMS because nobody talks about EMS until you need it. So,
So 9.6%
percent a year,
a year.
compounded annual growth rate, CAGR. Yeah, it's a lot.
Yeah.
And then you look at okay, what is the labor force looking like? It's not growing at that; it's shrinking.
Do you
So
know the numbers around that?
I don't know the numbers around that exactly, but
That'd be interesting to correlate those 2
well, I mean,
figures.
if you
I
look
know
at
there's a
them,
lot of people in the industry, they're probably taking these numbers down to start
yeah,
correlating
and
it.
and the
Yeah.
and the AAA, I think they have some numbers out there that just was saying that 1 in 3, EMTs and paramedics are, having burnout issues. Uh, Majority of people or a lot of the people that come into the industry don't even make it a year because they're like, "This ain't what I thought it was gonna be." So, it's the responsibility of us as, the business executive leadership for everything, private, public, and everything is we have to reduce the stress on them. So that is what Whistler Capital has also done for us is help us bring new creative ideas on how to reduce stress on paramedics and EMTs. Look, the business is inherently stressful. You're not going to alleviate every single stress. You're just not. It's a stressful business, just like being a police officer, being a firefighter, all of those things, they're all stressful businesses. And we know that getting into it. But we should be able to remove the amount of hindrance stressors uh, in the organization, and that is my number one focus. Because if I can remove the hindrance stressors in the organization, then we create an environment where paramedics and EMTs can do their job. They can be paramedics and EMTs, take care of people, and that's what we're here to do.
So I'm deviating a little bit from our
It's
outline
okay.
because you are taking this right where I want it to go, and you don't even realize it. So I had on my podcast, and I'm doing a lot of this right now. I've done a special series with a Clarity conference that we just did on
Mhm,
the West Coast, and I interviewed a lot with doctors. And so this year, my mantra really is data, doctors, and leadership.
mhm,
And Dr. Cozy, one of the chief medical officers for Chicago Fire, we had a great conversation podcast. People should listen to that if you haven't with Dr. Cozy. But he makes a comment in there that healthcare is a business and doctors were not trained to understand the economics of healthcare.
mhm.
But healthcare is a business. And whether we like it or not, through the perspective of the patient, I think it's hard for patients to sometimes digest. When they think business, they think Walmart. When they think business, they think Amazon. When
Mhm.
they think business, but healthcare in its own right is a business. And if we would conduct it like a business, we might be able to mitigate some of the cost. We may be able to have the reimbursement structures happen that way. And you're making a lot of comments right now that if we can run this aspect of the business appropriately, our EMTs and paramedics, our clinicians, can do what they were trained and hired to do, and that was to take care of our patients.
Yes.
And so That's the piece that I want. If you're listening today, I want you to pay attention to that, because you're bringing through what your master's degree is in understanding finance and healthcare economics is what you're talking about.
Mhm.
And I don't know if that's kind of the correlation when you went back during COVID to go get your master's degree in finance, if the lightning bell or the bell started going off saying, wait a minute, I need to have people around me that understand the economics of healthcare.
Mhm.
Because I
Absolutely.
really honestly believe that that is where we are in the healthcare debate that's going on right now,
Mhm.
not just at the EMS sector, but on the national front of
The
how do
entire
we,
ecosystem. Yeah.
because PE can see it pretty quickly. If you're a healthcare economist, if you don't know anything about healthcare and you just start paying attention to the number, this is what I talk to a lot of the individuals.
Mhm.
They don't know anything about healthcare, but they just look at the number saying, this is unsustainable. There's no business that can operate this the way this is going so quickly.
Mhm.
How do we fix that? That to me is, I think, the pivotal point that I want to bring back down here, because your focus is EMS, but there's a lot of people that are listening to this that aren't EMS. There's going to be healthcare. There are
Sure.
going to be people that are going to be really ecstatic and very happy that we're having this podcast. And then I'm going to have some people that are my friends who are like, Asbel, I cannot believe you brought somebody in to talk about the proponents of private equity. But I think it's useful in this space. Private equity is needed into this space. The good actors, the ones that are trying to be the co-builders. I'm going to use your word and give you
Mhm.
credit for it, Larry. Those co-builders. Why is it important for healthcare to understand the economics?
Well, you know, it was funny that you bring the economics of it, because when we started this business, I used to do our orientations, and I would go in and I called it the rumor session. I was like, okay, let's talk about rumors. What, and I would ask, you know,
Only you, Larry. That's a Southern thing to
yeah, let's
do.
talk about rumors.
I
I was like,
love
what
that.
what what do you think? Like, how much does that cardiac monitor cost? How much is this? Hey, how much do we get reimbursed for an ALS call? And I would hear things like $5,000, $6,000, $10,000. How much do we have a critical care call? Oh, that's just $15,000. And I was like, no. And I would bring up Medicare allowables and say, this is the majority of what we get paid. And it was literally every single time I did it, I would see the shock on their face. Like, what? Like, how is that possible? I'm like, yeah, that's what it is. And they're like, well, how do we operate? We have to be efficient. We have to be extremely efficient. So when we're talking about, hey, look, it's we're looking at in-service times, we're looking at all of these different things and every single KPI of the business. It's not because, oh, we think you're lazy, or that it has nothing to do with that. It's because we have to be extremely efficient given the reimbursement model that we have in this country, and that's how we operate the business. That's just it. And when you have whatever healthcare system or whatever vertical that you have, I think it's very important for everybody to understand the economics of it, both the macroeconomics of it and the microeconomics of it. The one thing that I learned in that is everything is tied together. Everything is tied together. When you think about right now, look at our fuel prices across the nation. You know, no EMS provider is getting paid more because gas is $5 a gallon. Not getting paid. Where does that money come from? Where does it come from? And when we look at decisions that are made on the macroeconomic level of, for example, diesel. People don't think, well, diesel, what is that? Well, because everything that got in this room at your house, my house, and everything got there by a truck on diesel. And they go, oh, well, yeah. So that's what happens when you don't think about the macroeconomics of it. You think about like, okay, I had somebody tell me, they're like, oh my God, we've got gas in my car is expensive. And I'm like, yeah, try having 340 some ambulances, with this fuel thing going on. So it makes you appreciate the macroeconomics of things and how they impact your business. And I don't think healthcare is inoculated from that. Amazon thinks about that. And the one thing that makes us a little bit different than the rest of the world in healthcare is if Amazon, and I hate to use Amazon as an example because it's a good company, but I'll just use them because everybody knows who it is.
Sure.
But, all right, Amazon has, I don't know, 10,000 trucks that deliver goods, and their fuel bill goes up, $1 million a week. What do they do to that? Does Amazon eat it? No, they don't. What do? They pass it off to the customer. They increase their shipping charges. They do all of these things that inevitably get passed on to the end user/customer. Do we do that in healthcare?
This episode is sponsored by Solutions Group Services, healthcare leaders' go-to source for maximizing reimbursement and inspiring innovation. At Solutions Group Services, our technology and consulting expertise help organizations recover millions in hidden revenue without disrupting their workflow. Through our flagship AI-powered tech product, Black Ink, we reveal the dollars stuck in insurance claims and give you the map to get them back. Because for healthcare leaders, they know leaving money on the table isn't an option for their organization. Learn more at solutionsgroup.com and discoverblackink.com.
So I think that's going to be an interesting, debatable concept. Currently for ambulance, no, it happens 2 years later, depending upon the way. And that's kind of a conversation that we're having right now around payment reform. Is should we relook at the way that we get reimbursed? Our model that we currently in our current system is almost 24 years old, 25 years old. We're moving on. And so that's people don't realize that we're talking from a structure that's 24 to 25 years old.
Yeah.
But let me ask you this, because I'm sitting here listening to you and I'm having kind of an epiphany moment. And I've had it with more of the physicians getting more involved in EMS, more physicians getting involved by hospitals, because, they kind of have looked at that. That's always been the issue is, hey, the doctor, the chief, they handle all the clinical side, and then we bring in the C-suite level who maybe have their masters in finance and they have no clinical background, but they know how to run a business, and they kind of been working kind of in tandem with each other. And there's a whole debate right now where independent physicians want to get more involved. They have been kind of sussed out because, physician can't own a hospital unless it's like a joint venture. There's all this stuff going on right now in the physician community. And I've really kind of looked at the intersection of that with EMS. Maybe the physicians need to be more involved, because EMS by large literally has been what you just talked about. I started as fire, I went into EMS, and you just kind of worked your way up the ranks until you got an economics degree and began to understand that piece of it, and things started to marry together. Like, I've always known this, but now I'm really understanding the micro to the macro perspective. I even understand more now that I've got Whistler Capital that's involved in too. Maybe that's the real reason why this needs to happen. There has been a vacuum in healthcare that has been filled by individuals in the private equity, venture capital realm, Wall Street, that they understand this is what they know. We may not like what they do. We may not like the margins that they're trying to get out of healthcare, but they understand this piece. And so I want to keep that away, because that's the next thing that we get to. And we'll talk about that. What are reasonable margins? What are fair margins? What are things like that? But healthcare has to have that. So I guess my question to you is, would that be far-fetched to think that is maybe they've been filling a vacuum, and that's possibly why this is happening, because we kind of have lacked it, and this is kind of elevating our industry to really understand? You've got to understand the healthcare economics. It's not just where we started in a volunteer fire, volunteer EMS at one time. You didn't have it, so people volunteered. And then it's kind of morphed over time. Maybe that's where I don't know. I mean, that's a question that I'm just turfing to you, see if you're comfortable answering.
Necessity is the mother of invention. And I don't think the American healthcare system has been in the shape that it's in now, in the sense of rising costs, labor shortages. And I'm not talking about EMS. I'm talking about healthcare.
Yeah, healthcare in general. Yeah, it's everywhere.
I have a friend of mine who is, in the C-suite at a very large health system. And he's like, we can't even get transporters inside the hospital. We can't get, environmental services. We can't get that anymore. And why? Well, you can't get it because there's other ways for people to make money. that there's just other ways. A lot of people don't talk about this when you look at like um, a multitude of different services or apps and everything that you can use that you can work, and it's totally different space that we're in healthcare. And I think that when you see private equity coming in, it's everybody wants to create value. There's nothing wrong with creating value. Um, Through value, when you create value comes innovation, and innovation is not cheap. Um, Innovation is very expensive. And if you want to do something that's different in this business, you have to be an innovator. You have to challenge the status quo in healthcare. I'm not just saying healthcare. I'm all healthcare. And to do that, it takes capital. And then, when you look at different ways to go get financing, there's a multitude of ways. You can go to banks, you can go to private equity, you can go public, you can do whatever you want. There's a multitude of ways to do it. Each have their own share of risks. They're all different. So what you have to do is it goes back to finding the right partner that believes in your ethos, that believes in what you want to achieve, and how can we, work together to co-build this business and provide value to the end user, which is a patient.
So let's talk about innovation. I'm going to pivot a little bit
Sure.
because you brought it up. And of course, everybody's talking about artificial intelligence.
Mhm.
I know that is an area that is very hot right now with venture capital, PE, investing in the space because and this administration alone has been doing some things around AI that's pretty amazing. They're trying to eradicate out fraud, waste, and abuse. I had a podcast a few weeks ago that I just released last week where Kim Brandt, the COO for the Centers for Medicare and Medicaid Services, was with us. So people can go back and view that if you would hear about that. But they're really utilizing it. She talks a lot about artificial intelligence and how they're using it to put together some data to test out the waste and abuse. The President Trump, in his initial budget put out, they believe that they're going to save well over $100 billion in the healthcare program. When we think about that, we're thinking, dear God, we need more money. And you think there's $100 billion, but it's waste and abuse in lots of different areas that they believe that the data is beginning to show them where there's all this fraud. This is why they're doing all these busts everywhere. So let's talk about innovation.
Sure.
Because that's where artificial intelligence is coming in. How are you looking at this differently now, now having a capital partner that's helping you to look at this a bit more? Are you taking different strategies around artificial intelligence that you may not have made had you not had a partnership with private equity? Or
Well, the interesting thing is that AI's not been around, the whole time that we've been around, or at least having access to it.
Sure.
So, and I would even say that the last 6 months, we have seen an explosion of it through multiple different venues of, software and out there.
It's almost like AI overload right now in my head.
Sure.
It's like it's everywhere.
Sure. It's everywhere, and, take your pick.
Yeah.
And, I think the biggest thing is one of the best things about EMS and healthcare is AI. And here's why. It's going to make us better. It's going to make us better. When you see companies laying off for, whatever reason, because AI has automated or AI has done anything, you cannot automate me at 2:00 in the morning in a ditch, intubating a patient while it's raining and thundering and lightning.
That's a great point.
You can't
This
do
could help
that.
with workforce shortage issues.
Yeah. And when you look at what AI can do, our whole goal, again, is to reduce the hindrance stressors on our paramedics and EMTs. And I tell people, and this is one thing I learned, there's only 2 stressors in any organization. There are hindrance stressors and challenge stressors. And hindrance stressors hinder you from doing your job. They hinder you from being able to effectively perform at 100%. So if, you're you're a mechanic and you don't have tools and you don't have the right tool to do what you need to do, then that's a hindrance stressor. And I think for any organization, regardless if it's EMS, healthcare, retail, whatever, the ultimate goal should be to reduce the hindrance stressors of your workforce. And that's always been our focus since day one. Um, are there stressors? Absolutely. Or do we have hindrance stressors? Yeah. But the thing about it is being able to focus on it. Challenge stressors are a little bit different. Challenge stressors are I want you to show up, give great patient care, be professional, be on time. Those are challenge stressors. And, they can be overwhelming at times, in some spaces if you give, incredible amounts of, projects to do, whatever. But, the thing about it is I think the AI use for us is to reduce those hindrance stressors, to make us incredibly efficient. And I think all of healthcare can use AI to be incredibly efficient
And I agree
because
with you.
because okay, let's say the federal government tomorrow waves a magic wand and just increases everybody reimbursement. It's not going to happen. You have to be efficient. So you have to be able to optimize what resources you do have and how can we make this better? How can we do this? How can we be faster? How can we get, better clinicians? How can we do better training? There's the one thing that, I tell everybody about AI, it's only limited to your imagination. And I'm not a coder. I'm not I know where to turn a computer on, but I do coding now. And I do things because I've taught myself. A lot of that was because of my partnership with Whistler Capital Partners because they're like, "Hey, look, check this out." And I'm like, "Oh, wow, how do we do that?" And, I went and bought my own stuff and learned my own thing and just the things that it's allowed me to do and in conjunction with Whistler has just been incredible. I mean, just some of the things that we're doing is absolutely just incredible. And there's a lot of stuff that we're going to be rolling out later on this year that's going to be, 100% to drive down the stressors of our workforce.
And I think you make a really good point that it opened up this network to you, this network that
Mhm.
you didn't realize was there to understand some of the stressors, as you're putting it, like what are
Sure.
the challenges. It's helped you eliminate some of those challenges. Now, this is no way am I saying I support one way or the other, whether it's private equity, do what you want to do. This is giving another spin that we don't generally hear.
Mhm.
Some of us talk about it behind rooms, we have whatever, but generally people are not talking about this in healthcare because it kind of goes to the point that I want to pivot to here around that we lose that patient-centered care side of things. There's been some, of course, the news media always likes the sensational things. So the whole debacle that happened with Stewart's healthcare that was over leveraged, they went out of business in some of the communities. This was a whole issue. This was a hearing on Capitol
Mhm.
Hill related to private equity in healthcare in general. We can't control what other people do. You can only control what you do, but one bad apple doesn't make it bad for everyone. But unfortunately, if they stay in that basket and people don't call it out, that becomes an issue that we have to pay attention to. So what are some of those things that you do in your company that says, we're going to make sure this same thing doesn't happen, so there are safeguards, safe provisions? Are there things like that that you look at
Oh,
that keeps the patient centered? Is there things that you can talk about, maybe
yeah,
a little bit
absolutely. I
about
mean,
that would be
one, let me start with this. Being from the South, you'll understand this. My daddy always told me that if you make somebody mad, they're going to tell 9 people. But if you make somebody happy, they're going to tell one. So when we have these bad actors, and I don't even say bad actors, but when we have these negative connotations around what private equity has done in the past, okay, what about the good? Nobody talks about that. What about in the 2008 financial crisis, how private equity helped pull the country out of that? What about all of the other things when it comes to infrastructure development, when it comes to all of that, when it comes to building ports, when it comes to helping our trade, when it comes to all of the numerous things that private equity helps invest in to build innovation, build infrastructure for the everyday American? Nobody talks about that. And that's the world that, I am not a pessimist, I am an optimist, and that's the world I live in. And, if you wanna go looking for negative, you'll find it. But, I challenge you to go look for the positive of things are doing. And when you see some of the things that, we're doing, um, it's always centered around patient focus. We're looking at different ways, different things, different protocols. Hey, how can we analyze this? How can we look at this? Everything is a data point. Everything is a data point. Everything is a KPI. How can we improve, our out of hospital
But that's
ROS?
not so bad, everything being a data point, everything
No,
being a KPI. You need to know where you're going. I mean, I don't see that, but I don't care if you're private equity based, if you're a governmental entity, if you're for profit. My God, we need more of that in government, in my opinion, of targeted KPIs. Like, do you know where your money's going? I mean, in my opinion, I don't think that's inherently bad, but it's just a focus that's saying if you don't tell your money where it's going, it'll tell you where it's going.
data is the currency of truth.
Yeah.
And
Data is the currency of truth.
a lot of people don't like to hear that. And when it was, it's just all numbers. No, numbers tell a real story. Numbers can paint a picture. And I find that, I used to have an old professor that said, look, your gut is for digesting food. It's not for thinking, and, when it comes to data, make objective, informed decisions. And, that is kind of like how we built AmeriPro. I mean, just 8 short years, 10 states, and continuing to grow. It's because, yes, there is very much a patient-centered focus. There's very much a focus on being a partner to all of our customers, not just our 911 customers or our interfacility customers, but, hey, we've got some data. Do you guys want to see it? Being able to go back to them and say, "Hey, look, this is what's going on. This is what we're doing. This," and and it helps solve a lot of misnomers out there.
So let me ask you this, because you brought up a point about data paints a picture, data is a story. You gave another analogy that I like. That was cute. That a professor once told you that
Mhm.
your gut is for
For digestion.
digestive, not for data is a whole other construct. But I hear the exact opposite from others saying data is just a portion of the story in healthcare.
Mhm.
There are still things that data might say. You know what? Out of the 100 patients you see, 0 of them that had a heart attack, as long as you give them this, they don't die.
Mhm.
But one time you could do the same thing and then they die.
Sure.
And then all of a sudden we change protocol. And I remember somebody told me, I'm going to leave them unsaid, basically said, you know what, Asbel, we're not trying to solve the problem for all Americans.
Mhm.
We get it. Some people elect whatever will never say that because you never can solve it for everyone. But we don't like to hear that.
Mhm.
And so some people don't like to hear that data does paint a story because it does paint a story. But what do you say to the other people that are saying, well, wait a minute, healthcare and patient care is more than just what the data paints. There's also a person, there's a story there. And sometimes I feel that gets lost in the data. What would you say to people that are saying that?
Well, I would say that, data is the currency of truth. And even when we talk about AI, it is very left brain. God gave us 2 hemispheres of our brain, and we need to use both of them. So I agree with those who say that data is a part of, patient care. If it's not, then why do we change American Heart? Why do we change this? Because we're looking at data. We're looking at things. Data helps drive how we change our pattern of care. We used to do bloodletting. We don't do that anymore. Even in the times when I was a paramedic, do not ever put a tourniquet on anybody. Do not ever put a tourniquet on anybody. Now, I wish I'd have invested into tourniquets because after, the Afghan and, the global war on terrorism, every police officer, every ambulance has what? A tourniquet. Why? Well, because of data. And we learn from data, and we make clinical decisions based on data. So yes, it does very much, that is a person, that is a patient that's going there, but we need to use the data to make the best decision and not just off of, kind of what we think,
So, what should we do as a healthcare industry in large? And this is going to get back into a few of this as we kind of wind this down, but I'm enjoying this conversation because it's bringing out a lot of things that I think people see a different perspective.
Mhm.
But let's talk about it through the lens of the patient.
Mhm.
So you're a businessman. You have a degree in healthcare economics. You have been, we could probably sit for hours and just talk about the business side of things, but I
Mhm.
want to move to the patient side of things. What are you doing at AmeriPro to make sure we stay very patient-centered while we run a business? Because healthcare is a business. That we need to understand that healthcare is a business. But how do we marry the two, and what are you doing from healthcare, from your perspective, your seat only? I'm not asking, it doesn't have to
Mhm.
be right or wrong, just this is how I view it, that we should always, how do we keep the patient at the center of this, but run it so I can continue to deliver care to the patient as they're needing?
So if you look at it from a patient standpoint, paramedics and EMTs are at when we're called to their side, we'll say in a 911 space, they're calling us at their worst moment. And I think as paramedics and EMTs, that's where we excel. And that is where we have always pushed at AmeriPro to be, look, the patient comes first. This is what we do, what's best for the patient. And, the other thing is, it's kind of cliche to say, but I've said this since day one. Look, there are a number of fast food restaurants out there that sell chicken sandwiches, but you go to Chick-fil-A. Why? Because it's a customer experience and it's God's chicken. But, everybody, but, we all go and, everybody goes to Chick-fil-A, and it's the patient experience or the customer experience that you get there. And I said, look, our hospitals, everybody has, um, a numerous amount of ambulance providers that can come and move patients. But we need to make it to where it's a customer experience for them and a patient experience. How are we doing when we're transferring, an ECMO patient? How are we doing when we're transferring, an LVAD patient or a balloon pump patient? Those are the types of patients, and a lot of them are sedated. Nobody, we don't think about that patient's experience, and that patient's experience is in the crucial part of the crucial hour of their life. So how do we impact that? And that has always been our focus. How do we deliver that level of care? And that's what I think not just AmeriPro, but every paramedic and EMT in the country needs to understand is like, how can I provide that best level of care? Even in the IFT space, you might just be transferring, an 88-year-old from, the third floor back to her nursing home. But you know what? Her family may have not have visited her for 9 months. She hasn't seen anybody. And you look like her grandson or you look like her granddaughter. Sit there and hold her hand. You know, uh, that is the level of service that you have to to give. And I think one thing that paramedics and EMTs in our industry, and there's been, even the police sector, the fire sector has all started adopting this, is like, look, everybody out there, patients, citizens, everybody is our customer as well. And they're very much, we are here to provide them a service. Unfortunately, sometimes in their most darkest hour. So the thing with us, as we has always been, is what can we do to reduce the hindrance stressors on our paramedics and EMTs for them to be able to do that? And most of the things that we have been doing since our transaction with Whistler Capital has been focused on that alone. And the partnership between us and them has just been, that's our true north. And we share that ethos. And I think that is one thing that we as an industry have to understand. We are really touching people and being able to care for people, even though sometimes we may not see it as an emergency, but it's theirs.
You make up a good statement, and the Richard Branson statement comes to mind. What you're just saying right now: if you take care of your employees, they'll take care of your customers. And in our case, if you take care of your paramedics and EMTs, they're going to take care of your patients that will get the experience that you want. And I had a podcast with Donnie Woodyard, and he said this to me. He said, at Asbel, many times what we see that the patient, their first experience that they have with EMS is when they get a bill. That's why there's been a lot of focused concentration. They didn't have any issue with the care. They were thankful that you showed up, transferred their baby who was in the NICU from one hospital to another. When they were having a heart attack, they picked up the phone, called 911, but their experience stopped at the moment care was transferred over to the hospital. And the next time they heard from you was when a bill showed up in the mail.
Mm-hmm.
And so what you're saying is that you've been able to do is really focus on what are we creating these hindrances? And right now, one of them is this has allowed us to really take a hard look at our experience that we're given to our employees.
Mm-hmm.
And so if that would resonate with the industry to really begin to understand, specifically if you're in healthcare, you don't even have to be in EMS. Many times that's what we see. I was talking to a doctor who is an internist for a large healthcare system up in the Northeast, and he made this statement. He said, so many of us clinicians, whether I'm a doctor, whether I'm a nurse or whatever, we are so disgruntled with the executives that are running the hospital system. They don't care about us. They don't care about the nurses. They don't care about the physicians. They don't care about anything. All they care about is their bottom line. How do you think that transitions over to them? They're like, we don't care that they don't care about this. We're like, great, go after them.
Mm-hmm.
Dismantle the healthcare system. They'll vote all day long for the senator or congressman that will do that. In the healthcare sector that they were, it was an amazing conversation that I had. Like, I'm thinking, this is the hospital system that employs 5,000 people in your community. And that's impacting or whatever. They're like, we don't care. Unelect them. That was their own individuals because they don't see us as human.
Mm-hmm.
That's what you're talking about.
Yeah.
And I think if we could focus more on the experience, and this is what it means to be a co-builder. And so for those that have been listening to the private equity side of it, this is the reason why I wanted you to come on. And I appreciate the candor that you were able to have here, to have that discussion. And maybe it could only been done by a Southern gentleman. Because all my Northeast friends who are in private equity, maybe you've been a little too rough on the podcast. But that's what you gave some really great analogies there, and I'm going to use that co-builder because I like that. Like, are we co-building or are we landlords? Because there's a whole different mindset that looks at it through the process. So let's do with something a little bit easier.
Okay.
As we're going to end up this podcast, and one is more about if Larry could just wave his magic wand, say, I don't have to worry about any legislative, regulatory, and there's one or two things in the healthcare system, and I know your focus is EMS, that you would fix, that would give that patient experience. What would be one or two of those things?
I'll start with EMS because that's
who you are.
That's who I am. And I think that one is we need to utilize paramedics and EMTs far more than what they're being utilized for, and to have the reimbursement structure to do that. And
what would some of those ways be if we had the reimbursement to whatever? Give me one or two examples.
So going back to what you were saying about somebody talking about, the practitioners being a hospital, being disgruntled with a hospital. Okay, let's flip that because that sounds largely like in an urban setting. So what about when you're in a county, you have two ambulances and it's in South Georgia or South Texas or wherever, there's no primary care physician in the community. There's no clinics. There's no urgent care. There's no nothing. There's EMS. Okay. So we're the healthcare there. Okay. But all we can do is take them to the hospital. Why can't we use them to be better and to be that community health partner? And that's what we're also doing. How can we be a better partner to the community, to be involved in the community, to help have a lot more buy-in on what we're doing from that standpoint? Because rural health in America is not the same as urban or suburban health in America. It is a total different thing. And the rural health, thankful this administration, pushed out the Rural Health Transformation Program, but that's a drop in the bucket. It really is. I mean, it's a lot of money. I'm not saying that $50 billion is, is not nothing to shake a stick at. But what I'm saying is it's just a drop in the bucket. When you look at...
Well, the healthcare economists would tell you that they're cutting $150 billion and giving $50 billion through the process, which what happened in the One Big Beautiful Bill. So I think that probably people will agree it's a drop in the bucket, but it's spurring...
It's something.
It's something
it's
that's...
spurring some innovation.
Yeah.
It's spurring innovation.
Transformation. That's why it's called the
Yeah,
Rural Health
absolutely.
Transformation
I mean, and you
Program.
look at, we're out in Nebraska, it's the healthcare resources. And, I could talk about hours for this about, when you look at it like a rural hospital, what resources do they have? You know, what about them? How can EMS augment their services? How can we leverage the two? We have clinicians. They're very well trained. Paramedics are, pretty smart people, and they're used to dealing with high stress environments and very high stress cases. So why aren't we using that? Why don't we start leveraging that? So from that standpoint, I think that if I could wave a magic wand, that would be it. Look, we've got a number of people in this industry that can do amazing things. Take the chain off the collar and let them go do it. Let's do it. Let's get out there and impact healthcare and get access to healthcare and get people who don't have healthcare and get programs going that we can champion.
Take the chain off the collar. There's another Southern phrase.
That's it. Take the chain off the collar,
I
let
agree.
that dog run, and let him go. And I think when we do that, you'll see a huge transformation in this country's healthcare, because one thing that you said a second ago, that, we're also the first experience that most people have to healthcare.
Or the gateway.
We're the gateway.
Or the gateway.
And as EMS providers, we need to understand the impact and the importance of that. What does that mean, being the gateway? I mean, wow. I mean, all right,
But it comes with responsibility.
it does.
And so it's one thing for us to say we're the gateway because we've talked about it. Now it's being demonstrated in the Rural Health Transformation Program, because what that has done has caused providers that have generally operated in silos
Mm-hmm.
and maybe on the periphery we've tried to join hands, but now it's actually forcing that. But it does require more responsibility from the EMS profession as well. And, that's kind of an interesting thing beginning to happen through this process.
Yeah.
What keeps Larry up at night? What's one thing that keeps you up at night?
What drove me to start this business? Paramedics and EMTs. I love this industry. I built a company for paramedics and EMTs to be paramedics and EMTs. And EMS is a difficult business in this country. It's difficult because you're dealing with practitioners, providers who see the worst of the worst. And we just don't have enough of them. And something's got to change, whether it be through reimbursement, education, all of these different levers that we can pull to be able to attract people to stay in this business and people to come in this business. Because right now, that's probably the biggest challenge for everybody. Whether you're a public provider, a private provider, doesn't matter. Everybody has this issue. And, I tell everybody, it's like Waffle House. We ain't got locks on the doors. We're 24/7, 365. It doesn't stop. And when you look at some of the statistics, they're staggering out there about the labor force. And, everybody out there is banging the drum on reimbursement. And I'm not saying that's not an important thing. I'm not saying that at all. What I'm saying is in parallel, this industry needs to focus on the paramedics and EMTs and focus on what we can do as a community to be able to retain this labor force, retain the workforce, bring new people in, and for them to stay. That's what we got to do. That's the one thing that keeps me up at night. And, that's the one thing. And, was talking with, my partners over at Whistler, and they asked me the same thing. What is it keeps you up at night? I'm like, this is why this has to be our focus, to reduce that stress.
It's interesting that you bring that up, because we were talking about this in the car all the way over here, like this newer generation. A lot of our generation is getting older. How are we attracting newer individuals in here, newer individuals into the leadership structures, the management structures? What are we offering them? It literally goes back to, I keep the Richard Branson quote just keeps running in my mind, saying if we would take care of our employees.
Mhm.
They will take care of our patients. They will take care of you. And the issue is maybe we've got this backwards. And I like it that, and I didn't take offense to you at all saying not saying a reimbursement is important. Of course, you need that.
Mhm.
You need that piece of, but maybe we have focused so much on that. We've lost sight of what the real priority is, and all that will come into clarity the moment that we continue to circle this around as
Mhm.
well. Larry, I can't say thank you enough for coming on.
Thank
Number
you.
one, a difficult conversation from my perspective and from other people that understand of what is the benefits of private equity, not just in EMS, but the healthcare space in general. What are the pros and the cons of it? What are the upsides? What are the downsides? Everybody has their own viewpoint. I'm hoping that people will listen today to hear a different perspective
Yeah.
on why private equity is important in healthcare, because I think it is needed in healthcare. I think it would be detrimental to healthcare if laws were passed that were too stringent, if we took this different type of perspective for it. And we're kidding ourselves if healthcare is not a business. It is a business. The physicians have indicated it is a business. And like the Catholic charities say, no margin, no mission.
Mhm.
Now, I'm happy to have the debate about what a reasonable margin is, a fair margin is. I don't like the word fair because I think it's subjective, but a reasonable margin is. Happy to have that debate. But I really think it's not really debatable, is private equity needed in healthcare in general, not just EMS, but in general. It is needed for that because of how quickly innovation's happening.
Mhm.
And that is one thing. And you brought up some really great analogies that I've really had something I never even thought about when we have the crisis of 2008, when we have all these other things going on in our society. It's private equity that generally comes in and makes sure
Yeah.
it keeps the markets where they need to go. That we as Americans, we're a fast food society, and we need to understand the benefits of what that actually helps in general.
Yeah, when you look at it, I mean, look, there's you can find negatives wherever you look for them, and that's not been my mantra, never has been, never will be.
Because
I
negativity never solved anything.
no, no,
Never.
I tell everybody, stay away from negative people because they have a problem for every solution, you
That is
know?
the truth. That is the
They have a
truth.
problem for every solution.
Yeah.
You could, and, "Well, here's $1,000,000." I gotta count it and take it to the bank. Geez, it's like, you know
As they say, be in room of builders. I
Yes.
will not be in rooms where it's just critics. I'm fine if you want to critique as long as you're building.
Sure.
That helps you understand where the landmines are. Other than that, I'm not in the room with you. Be in the room of builders. And that's what you're doing. You're building. You're in a room of builders. And that to me is kind of where PE kind of gives a different builder mentality, is
Well,
generally what they're doing.
I think it says a lot, you know, of my trust in Whistler Capital for me to uproot my children. My son's 15 next week or in 2 weeks, and my daughter just turned 13, and my wife to move to be closer to them because we have that great of a connection and the synergies between us and what we're doing together. It was just that important to be there with them, to be like, all right, this is what we're doing, this is where we're going. And, I would not turn back 1 minute. I would not turn back 1 minute.
Well, I appreciate, Larry, for you joining here as well. If you're listening today and enjoyed this conversation, hit the like button, subscribe, share it. The more shares we get, the more likes we get, the more this message gets out there as well. And if you didn't like the conversation and disagree, comment below. Send us an email, info@solutionsgroup.com. Happy to have the conversation, but I think conversations are important. Conversations are important to the dialogue. Thanks, Larry, for
Thanks.
joining. You
Thanks
bet.
for having me.